My name is Jason Langdon. I'm the project director for the SPIRE HRM project, overseeing two LHINs, Erie St. Clair and the Southwest LHIN. A couple things before we get started. I know you got an information package, so in the information package itself, there's some documents related to the actual project and signing up and getting connection to it. Ninka and Jackie will get into more details around that, but that package is there for you, as well as a copy of the presentation. So please feel free to take down some notes as I'm going through the presentation. We'll take two question and answer sessions. So we'll do one after I'm complete, as Glenn indicated, and then at the end of the actual change management process and end of the presentations, we will have another question and answer session at that time. During those times, I'll open it up for everyone. We're going to grab a mic and come around so that we can get the questions vocal, so that everyone can hear what the questions are, and then I'll provide the answers as much as I can to make sure we cover off whatever requirements you have. So, why are we here? SPIRE HRM. So the SPIRE project itself started...
So, we're talking about the South...
So the SPIRE project itself started a number of years back, and it's grown across the Southwest LHIN, and we're now linking it into something called HRM. So we built this video that you just saw a quick clip of, that we did for a presentation that we had for the HIMSS conference in Vancouver early in the spring. And it's a great little intro and a little way of getting you kind of familiarized with our project and to kind of start things off. So we're going to go through that now.
West Physicians Office Interface to Regional Electronic Medical Record today. Yeah, it's a mouthful. We call it SPIRE for short. SPIRE is an electronic interface that allows patient reports to be sent from hospitals to a secure electronic medical record, or EMR, that lives at your doctor's office. Sounds pretty simple, right? Unfortunately, it wasn't always this easy to get information out of a hospital and into a doctor's hands. In the Southwest Local Health Integration Network, or LHIN, where SPIRE was developed, there used to be only two ways doctors could get these records. Physicians who practice in close proximity to their hospital could get them by fax. But if their patient wound up in a hospital that was far from home, well, those reports would come by snail mail. And this wasn't ideal for anyone. It could be weeks before a patient's information would arrive at their physician's office, and staff would have to spend hours filing paper copies, scanning documents, or transcribing notes into the EMR. This wasn't ideal for patients either. Nobody wants to have to wait for lab results when they're sick. They don't have to anymore, thanks to funding from eHealth Ontario. SPIRE is part of eHealth Ontario's strategy of funding local healthcare initiatives that connect hospitals with primary care physicians. SPIRE provides a way for doctors to get all that important medical information electronically and within minutes of it being signed off at the hospital. Using secure message protocols, we can now send lab and diagnostic imaging reports, medical reconciliation documents, discharge summaries, and other transcribed notes directly into those certified EMR solutions that doctors use, right in their very own offices. Not only can patients expect their physician to have their medical reports much sooner, but they can rest assured their information is more secure than ever before. This also means no more faxing, no more snail mail, and no more need to manage paper copies or scan or transcribe information. But what does this mean for physicians? In the Southwest LHIN, it means hours and hours of time that used to be spent filing can now be spent on patients. It means more up-to-date information in patients' charts, and it means doctors can use that information in new ways, like graphing discrete data, or selecting text from reports and creating alerts to help them deliver better care to more patients. It means good things for patients too. The more timely information your doctor has about you, the more informed his or her treatment advice is going to be. For example, a significant number of emergency readmissions are due to drug conflicts. If your physician knows what drugs you were prescribed at the hospital, he or she can help you avoid problems after you've been discharged. In partnership with Ontario MD's Hospital Report Manager, or HRM initiative, we can now connect any physician with any hospital in the Southwest and Erie St. Clair LHINs, and we're working on expanding that catchment area further. We can also connect physicians to the records that live at independent health facilities, and we're looking at ways to send hospital information to the community care access centers and long-term healthcare providers. We're also looking at ways to extract data from the EMRs so that patient information can be shared with professionals at alternative healthcare facilities, like emergency room physicians and specialists. Everyone will benefit from having a standard electronic health record, and SPIRE HRM takes us closer to making that a reality. For more information about what SPIRE means for you, visit the Southwest LHIN online at www.southwestlhin.on.ca or eHealth Ontario at www.ehealthontario.ca.
Okay, so that's a little introduction to the project. It's something that we used, like I said, at the HIMSS conference. Went over very well, gave everyone a little insight to the project, and kind of got us familiarized with where things are going. So let's start with the history of SPIRE. History of the project started in 2007 at Grey Bruce. It was a physician who said, I have an EMR and I can accept electronic data. Can I get some information from the hospital? Hospital took some internal dollars, bought a primitive, simplistic interface engine, built it up with their own technology, and started sending messages to physician offices. Because of this, the great response and the efficiencies they're receiving from it, the ministry got involved and said, let's expand this project and do something larger around the London area. Hence, we coined the word SPIRE, Southwest Physicians Interface with Regional EMR. Started building out in 2009 to increase the number of physicians, and actually built a little bit larger interface engine, built on the technology that we used at Grey Bruce, and expanded it and started to kind of implement more physicians. Continued that through the LHIN, and we now have 3 centralized hubs, which I'll get into in a minute, but it's here on Perth, Grey Bruce, and the South in London that are sending out messages, and we have over 450 physicians now connected across those 3 hubs. Give you some indication of the type of EMR vendors that we're currently connected with include AbleMed, Acuro, HealthScreen, which is going away soon, Nightingale Practice Solutions, and Bell X-Wave, which is one that we're moving on to in the near future. So giving you some idea geographically of how this looks. So across the LHIN, we have 3 hubs that collect information from local hospitals. So Grey Bruce is a hub for 6 hospitals, here in Perth for 5, and in the South it's for 12. So they're all pulling information onto one centralized EPR solution, like a Cerner installation, collecting that information and sending it out to physicians local to that area. Physicians connecting to one of the hubs. So one of the issues we have today under our current model, and where we're getting out of by going through HRM, is that we can't send information from a hospital in the South to a physician that's connected in the North. So if you're connected to the South region, you cannot receive information currently from here in Perth. Each one is a single connection only into those hospital groups. But it's a stepping stone in where we're moving forward, and we understand that. So where we're going is we want to integrate we want to be able to link into Erie St. Clair. So bringing Erie St. Clair onto the project through a central hub that Glenn mentioned, which is CHIS, Consolidated Health Information System. They're a central hub for the 5 hospitals in that area collecting information. Then we're going to move to something called HRM. HRM is Hospital Report Manager. What it is another initiative within the province for connecting physicians to hospitals, and they're doing that in the North Central Muskoka area. OMD is currently managing and running that implementation. It's under a pilot process at the moment, moving the same type of information we're doing here in the South. Only difference is they're not including lab data, but they are connecting and transferring data. So once using the SPIRE's knowledge and experience that we've had from implementation, leveraging the technology that HRM has, it's a very robust interface engine that allows us to do a number of different things, taking that environment, moving it into eHealth Ontario's managed global data center to actually house this technology and be the transfer agent, leads us to where we're moving with the project. So we're going to take all of the current connections we have today, link them into this centralized hub at eHealth Ontario, reconnect any physicians that are currently connected to an office, and I'm going to use Dr. Japeski, who's be talking later. His office is connected to LHSC today. One of our site support staff will go into his office, change his connection to eHealth Data Center, at the same point that we're also repointing LHSC to that data center. What does that mean for Dr. Japeski? It means he's going to get the same information transferred at the same rate, the same way he always did, but now he has the opportunity to get data from any other hospital in Erie St. Clair or the Southwest LHIN. So it's going to take some time for us to get there, to transfer each of the hospital groups over, but talking at an end state, that his office, if any one of his patients are seen in any one of our 4 hospital hubs, and that patient identifies that Dr. Chapesky is their physician, that information will flow to his EMR and be downloaded into his EMR for tracking purposes going forward. There's a number of different protocols and processes and procedures around this, but that is kind of the simplistic layman's terms for us to get us from where we are today to more of a centralized global model. HRM is that global model that is already licensed for all of Ontario. So as we are going to be linking into this HRM platform at the eHealth Data Center, North Simcoe, Muskoka, the current pilot project, will also be doing the same. And the HRM team, which is Ontario MD managed, eHealth Ontario funded, they're also on an advancement of that project called the HRM expansion. So they're looking to get other hospitals and other LHINs connected to this so that we have one centralized hub environment for sending information from hospitals to physicians, which gives us the ability as a physician to receive data from essentially any hospital that's connected into the HRM platform, and at someday that should be every hospital. So talking about some of the benefits. Delivering this information, and I know that we have a group here that have some physicians that are connected, some that aren't, so for some that are connected, you may be nodding your heads or telling me I'm totally wrong, hopefully I'm right, but we are going to give you some information on kind of how things work. So secure delivery mechanism. So as you're getting paper copies through faxing today, a fax piece of paper comes off a fax machine, has to be collected and put in its proper location and managed. There's an opportunity for that to get lost or something to happen with it. Secure transfer, there's no way for that to happen. This data is going through encrypted SFTP, can't be captured, can't be deciphered, as well as once it gets to your EMR, you need to have access to your EMR solution to actually get at the data. And even if you do have access, you got to understand how to view it and how to record it. So there's a lot more secure process with getting the delivery of this information. Saves time for physicians. So on average, again, we've done a poll of information from physicians, and we've received that it's quicker for them to review information. They get to scroll through the different reports, and as they sign off on each report, having reviewed it, it automatically gets attached to their patient chart. They don't have to do any other, they don't have to take the data and hand it back to one of their staff to make sure that it gets filed properly. It all happens automatically. It takes a lot less time for staff. They're not having to collect this information off the fax machine and having to get that put into filing and get it to the physician to review. Saves time overall on both sides. Accurate and timely information. So as data comes off from a fax machine, we often find that the toner could be out, there could be some misread items on the actual report because of the way it comes off the fax machine, causing you to either call and get the information clarified or to get to a point where you've got you're actually getting the report resent to you. So with it coming electronically, it's completely accurate. Every data element is tracked and loaded into the EMR solution, as well as the information comes across very quickly. So as soon as it's signed off at the hospital, there's a background process that's listening for this type of information and automatically sends it through our HRM SPIRE platform. Can be received within minutes. Again, just to clarify, the data is moved to an SFTP download location, and it's based on that physician's office, how often you download. Most offices download every half an hour, but they have the opportunity to cycle that at any time they want. So if that information was sent to their SFTP folder and they happen to download it, you can get it within minutes. It also eliminates the need for data entry. So we know that a lot of offices are actually scanning information, they're rekeying information, that takes time. And that's time that could be used on other aspects of the physician's business, like seeing more patients, and getting graphic information, reporting, a number of different accuracies that can help with. As well as the data can be graphed, and you can do searches and selected text. So let's say the report comes in, a physician can select that information and move it into an alert to remind them to talk about something from the report when their patient comes in, and or can ask that their frontline staff contact this patient to have them come in because the physician needs to speak with them. All components of the benefits of this. So talking about the types of reporting and how we actually filter this information. So we're doing this well in LHSC today, and it's clear that it's the same process as it was in faxing. So we're doing the same process for the other sending facilities, that it's whatever you would get from faxing today, you also receive from the electronic transfer. In some cases, physicians will say they get more than they used to. In some ways it is more, in other ways it's kind of what you had before, only some reports have to come into your EMR. You can't take inpatient lab data and do something else with it. It actually comes into your EMR. So those are types of things that we are aware of, and we're trying to put together methods for filtering some of the information. We know that some rural physicians that are in the EMRs doing ER sessions may want that inpatient lab data because it's one of their patients that they saw that evening or that day that they were at the ER, and they want to track that information. Other physicians say, I have no need for that information. So we're looking at mechanisms within the migration to HRM to filter out that data, and I'm just going to say that we are definitely have a process to that, and we're configuring and working through how we're going to actually be able to do that. As well as, to be clear, so the type of data that we're sending today, lab data, diagnostic imaging, MDocs, as well as any medical transfer card notes, medical discharge summaries, and in the north we're starting to send out medication reconciliation notes. So that's the actual medications that the patients were on when they left the hospital. We're bringing that into Grey Bruce, and we want to spread that across the other hospitals and have that information coming across as well. To be clear, the other thing that we're not sending through is the actual image from the diagnostic. It's just the diagnostic imaging report. So there was a study done by Infoway that looked at the benefits of connecting with EMRs. So to kind of give you a little bit of a chart to understand the numbers of resources or bodies that are required by each spectrum here. So we have paper across the top, shows you how many bodies are required to get paper out to a physician. Then we talk about scanning, the middle section, which is getting that report to a scanning perspective. And then what it is from an EMR perspective, that there's a reduction in the number of resources that need to be involved to send this electronically. And they actually came up with some statistics to show that it's 16 steps for paper, 10 steps for scanning, and 5 steps for the electronic transfer, coming from 17.9 minutes down to 2.3. And overall, they're looking at a 93% faster movement of information. Now that was done at Infoway, and that was done at a number of spectrums, so not something that we've done within our project, but this is something that they're seeing overall from sending electronic data to a physician's EMR. Some of the challenges that we're receiving, we do have inpatient lab data, as I indicated, that's coming through, and we're looking for ways to filter that. Duplicate reports. A number of the EMRs have issues with making multiples of a report within their solution, and sometimes you'll see you'll have 2 copies of a report. One thing that our frontline staff does is we work a lot with the physicians to identify any type of potential issues that are coming within their EMR and help them leverage and put that in, move that information to the actual EMR vendors to say this is a problem, this is something that we're seeing, to help them correct them. They have done quite a good job to date of trying to address these issues, and they are getting minimal. The list that we would have had started 3 years ago, I swear it'd be like 30 or 40 different issues, and we've reduced that down to really about 4 or 5 that we're really kind of dealing with at the moment. New EMRs to the project is an issue. So at the moment, because we're still under SPIRE, we have a certain HL7 message format. Most people don't even know what that means, but HL7 is a type of format for a report to be transferred to physician offices. Connecting a new EMR takes time because we need them to take our message type, configure their environment to accept this type of message, do a bunch of testing and configuration. So that is a challenge we have today. Moving to the HRM platform allows us to bypass some of these mechanisms at an end state. So is anyone familiar here with the Spec 4 certification process for EMR vendors? Anyone heard of it? Couple? What is happening with the OMD is they're trying to create a standardization for EMR vendors to have them align to certain components and principles within your EMR so that they're not all doing things differently, as well as the ability to interface. We're standardizing to one inbound message format for things like the type of lab data or the type of information that we're sending through, as well as OLIS connections. So the newest Spec 4 aligns to one type of a download message format for many hospitals. It's called XML. And what it allows us to do is that we no longer have to go to each EMR vendor and say, you need to load our spec. We have one spec for Ontario, plain and simple. So as we link to HRM, part of the whole project process is for us to convert our current format to that standard XML outbound, which means when we get to the end state of the project, we no longer have to go to EMR vendors and say, do you want to be part of this project? Please follow these standards. We know if they're Spec 4 certified, there's 12 vendors in Ontario, by the way, that are Spec 4 certified. Any one of those 12 vendors can automatically connect without any issues. Basically, it's just an integration piece of getting them up and running and get them started. And just overall EMR struggles. As we know, EMR vendors do upgrades, and as they're often called, downgrades. I think it was Sonny Sejic that coined that term. That there are issues when you do an upgrade with your EMR vendor themselves. So we work as hard as we can to be proactive with those EMR vendors, ask them to provide us with as much information as they possibly can with respect to new versions coming out, upgrades happening, so that we can be aware of those offices. Because as we'll get a call in that'll say, I'm no longer receiving lab data, or we're no longer receiving anything into my EMR, we're going to go through other processes first before we go and check what version they've just been upgraded to. If we're aware of that, we can say, you just got your upgrade yesterday, yes, okay, we're aware of it. These are the type of issues we're seeing, and hopefully correct it much quicker. But those are the types of things we're working through, and we're trying to be that conduit between the hospital and the EMR vendor themselves. So talking about how the SPIRE HRM project aligns to other things that are happening within the province. So there's Ontario Lab Information System. Who's familiar with OLIS? A couple people. So I know that we've heard OLIS has been around for maybe a couple of years, still working on progressing, but they are at a point where they're going to be connecting into EMR vendors very soon. We're working together with the OLIS integration so that as we come into an office and we're the SPIRE connection, we're also going to help you with the OLIS connection and clearly help each physicians and their frontline staff understand what the differences are between the two. So as we know, we're sending lab data through SPIRE today. Eventually, all your lab data will come from OLIS. The same way it's coming through for SPIRE today, but with some additional benefits. You'll have the ability to view data from the OLIS viewer. So if you have a new patient that comes to you, you can't get any of their past data, you can go into OLIS and reference that patient and select any types of reports you'd like to have downloaded into your EMR. It's one component of it. The other component of it is it flows same as it does within SPIRE, is that if your patient is seen in the hospitals, that it will automatically send that information and download it to you. This is all coming in the next year to year and a half. The integration will happen between the two, but we are part of the project and we'll make sure that transition is as seamless as it possibly can be. Next piece is the hospital report manager as being a standardization. So like I said, HRM is here to stay. It has been licensed for all of Ontario, and it is going to be the download mechanism for all EMRs going forward from transfer of lab data and possibly other units. One thing I didn't mention is that we are also connecting an independent health facility to the project, which is London X-Ray. Barb's here. Where'd you go, Barb? Barb's in place from LXA. We're linking in London X-Ray to send the diagnostic imaging data through our same SPIRE HRM hub. So we're also looking at the potential for including other independent health facilities. If it makes sense and we can transfer the information, we already have a connection to the physician's office. Let's send as much information down as we can. And the final piece is something that Glenn already alluded to, which is the SWO project. Getting more specifically into SWO is built on a number of foundational elements. So using existing technology that we have today to leverage and advance across 4 LIN collaborative. So SWO, Connecting Southwestern Ontario, runs from Windsor to Niagara Falls, and everything in between, Kitchener-Waterloo, Hamilton, Toronto, London, all the way through. That's one project group. So we're going to be leveraging current assets. SPIRE HRM is one of those. Clinical Connect is another. I don't know if anyone heard of that. Clinical Connect is a project initiative that's happening within the LINs 3 and 4, which actually provides a viewer tool to see data from hospitals. It also has a download component to the EMR vendor, but overall it gives physicians the ability to view and look at any and all data that is contained within the hospitals, within LINs 3 and 4, to provide physicians with insight to what kind of medications they may have been on from a hospital perspective, what kind of reports they've done, so that we don't have to redo reports. You can review existing information, and you have the ability to download from the EMR. As well, we're looking to, the SWO project is looking to build an LDR, which is a local data repository, where it makes sense. So there's a number of repositories that are happening across Ontario. There's one called DIR, which is Diagnostic Imaging Repository. There's also a DIS project for drug information, a number of things happening. But we're looking to leverage and build a local data repository for any of those data elements that we don't already have in the hospitals or have a way to connect to. A good example would be pulling information from an EMR, such as medications, so that we understand as physicians, you have more information. So as a hospital, would like to know what medications a patient was on. If they enter the ER and they're unable to speak or unable to identify what kind of medications they're on, having that information for an ER doc is beneficial to them to make a quicker diagnosis. Those are the types of elements. So the actual SWO itself is built up of 3 components, which is the viewer product, which we're going to be leveraging Clinical Connect, the HIO technology, which is Health Integration Access Layer, which is the SPIRE HRM component, which is going to be part of that, to do that linkage to physician offices, and then a CDR, which we're actually coining as, which is a local data repository, as opposed to clinical data repository. That's what SWO is looking to do, and we, being a foundational component of that, are paving the road for us to get that project up and running so that we can expand HRM across LINs 3 and 4, bring Clinical Connect across LINs 1 and 2, and have a complete integrated model. So what does it mean to physicians from a transfer perspective? I kind of discussed this a bit, but again, physician offices that are already connected today will get connected through to HRM. Our on-site support staff will manage this whole process for you. You won't be left to do it on your own. There'll be new documentation that will need to be signed because we are doing an agreement now. We are connected into the eHealth data center managed by OMD, and we'll actually have to change your connection port, but that will all happen relatively seamless to the office. It'll happen by our staff, and that's part of the second phase of this presentation. We'll be actually take you through the whole change management process and get a clear understanding of kind of how we're going. So again, just to show how it's going to flow, current model today, 3 different hubs. End state model is going to be all of those hubs connected into one centralized repository to provide data across multiple spectrums. So getting into some of the timelines, what does this mean to us? So all I can tell you is that at the moment, this is the plan. Things could shift slightly, but we are moving on track. We're looking to implement 3 HSPs. That would be LHSC, CHIS from Erie St. Clair, and London X-ray, connected into the HRM hub through eHealth Ontario, and also have a pilot site in each region receiving data from those locations. That's going to happen by the end of this year, 2012. Then post how that is working and functioning properly, and we've done a lot, the end-to-end testing and moving information, we're then going to start proceeding with additional implementations as well as transition of current at the same time over the next 9 to 12 months. Actual timelines of when your office is going to be either connected or reconnected is determined by how quickly we get your information package back. So our staff are already connecting to current offices to collect the information that we need. If you're a new physician, we need you to fill out the information packet that you have in front of you and connect up with our change management team so that we can get you on the list to move things forward. So objectives of the project is to connect all 4 hospital hubs. That's, again, just to recap, it's Grey Bruce in the north, Huron-Perth in the middle of Southwest Lynn, LHSC in the south, the CHIS organization from Erie St. Clair, as well as an independent health facility within the scope of this project, 130 additional physicians or nurse practitioners in Erie St. Clair, and all of our current connections that we have, and plus an additional up to 580 at a minimum. Again, the project is not limited by how many connections we have. We want to get to those numbers at a minimum, and then we want to exceed them. The idea here is this project isn't just in phase and it's going to end at some point. The end state is going to be that it's going to transition into a regularly supported process within the eHealth support mechanisms so that as new physicians come on board and your office is connected, or you get a new physician into your office, that there will be a standard process for adding them to SPIRE HRM. And the project phase for us is to get everything in place, get as many physicians connected as we can, and reconnections, and build that whole support mechanism so that we can transfer that over to eHealth Ontario so that they can continue to monitor and continue to support this process going forward.
So now we'll go to the second part of our evening, which is our change management, implementation, support, and all-around physician hand-holding team, Ninka and Jackie, to walk you through the methodology that we employ while you sign on, and what to expect when you transition over to HRM, and what to expect ongoing when you need support for the either the utilization of your EMR or how you're connecting out to SPIRE. And then after that, we'll hear from Dr. Chabinsky, who's testimonial of a use of the system, and you can then talk peer-to-peer on what it's like to use the system. In our earlier session, we talked about a lot of what you're using tool A for, which is SPIRE HRM. Understand that within the context of SWO, when you saw the diagram that Jason showed you earlier with 3 pillars, the other tool that you're going to have forthcoming, outside of tonight, but forthcoming within the cluster project of an integrated EHR, is Clinical Connect. How many here in the room have actually heard of Clinical Connect? Okay, so a few. Okay. So there's a pretty awesome tool too that we'll have a session on, which is a viewer which allows you, no matter where you are, what you're doing, your location, well, what you're doing, I mean, you're doing some things that maybe you don't want to be looking at a viewer from, but no matter where you are, your location, you'll be able to see all sorts of information on a particular patient, no matter where that information is stored. So, whereas SPIRE converts information from your hospital system into your point of service application, which is your EMR, the portal, which will marry up a different approach, but a complementary approach, would allow you to see information from any place that patient entered the system. So that could be the CCAC, so in the CHIS information, or the CRIS information system. That could also be from a long-term care facility. That could also be from either a hospital or another primary care physician's office. The Clinical Connect portal will allow you to see that information no matter where you're at. So you'll have 2 tools, and we of course will minimize the amount of logins and minimize the amount of sort of passwords you have to use. But you're going to have effectively 2 tools in your toolkit. Tonight is only focusing on SPIRE and HRM, but we are happy to answer questions about Clinical Connect. I'm here afterwards as well if you're wanting to ask questions about that as well. But do know that a lot of the questions you're asking, a lot of the good challenging ones that Gord and some of the others are asking, effectively in the near term you'll be able to resolve using a different tool, which is Clinical Connect. So just wanted to make sure you're all aware of that. So with that, I'd like to introduce Ninka and Jackie to come up and present the more softer side of things after Jason did his to-the-point presentation on the service delivery that we provide within the SPIRE HRM change management team. So, Ninka.
Okay, good evening everyone. As Glenn mentioned, my name is Ninka and I'm the change management lead for the SPIRE HRM project. As you can probably guess from my job title, change management is something that is really near and dear to my heart and something that I really support, especially in projects like this. Not only is good change management critical for adoption, but for long-term sustainability as well. Now, I really could stand here all night and talk to you about the importance of change management, but the reality is change management really does and can mean different things to different people. So if there is one takeaway that I want you to have from this portion of tonight's session, is that you know that as physicians and office staff in this room, that you're going to be supported by our team during every step of the implementation from start to finish. So the SPIRE HRM implementations, unfortunately, don't happen overnight. We work collaboratively with a number of groups and have a large number of legal agreements and documentation that need to be completed before your implementation can happen. And as such, we do require a small portion of your time as physicians and your time as office staff as well to make sure these are complete. So how does our team support you through this? Well, we have a group of individuals that are part of our change management team called Site Support Representatives. These are the individuals who are actually going to be working with you right out in your clinics throughout the implementation from start to finish. In fact, as a new subscriber to the project, you actually get assigned your very own site support representative. That rep will come out to your clinic and actually help you complete the legal agreements and project documentation. Not just to make sure that it's completed, but to make sure that you understand what you're signing and understand what the process is going to be going forward. They also help with workflow reassessment. So taking a look and really understanding how you practice and how you receive your reports today, and what resources in your clinic are part of that process, and how is that going to change and be impacted once you implement SPIRE HRM. The site support actually also comes on site the day of implementation as well to make sure that your connection is up and running through a testing and validation process, as well as offers training to both you and your staff. So one of the things that I'm very proud to offer our physicians and proud of our change management team for is the support that we offer. And it doesn't end the day that you implement SPIRE HRM. Our team is here to assist you long after you've gone live, whether it be with troubleshooting or maybe you just have a simple question or concern about hospital processes, maybe just EMRs in general, but our team is here to help in any way we can. Our goal here really is to make sure that you not only have the knowledge and support to use the SPIRE HRM connection, but that you have the ability to put that knowledge into action and incorporate that into your daily workflow on an ongoing basis. So that being said, what I'd like to do right now is actually take you through what an average implementation would look like and what would be required of you and what support our change management team will offer. So to do that, I'd like to bring up one of our site support representatives, Jacqueline Davies.
Thank you, Ninka. All right, so Ninka's explained to you guys how important it is that you embrace the change management process. So now it's my turn to take you through what that change management process is actually going to look like. I'm going to first go over the process for new subscribers, but I'm also going to touch on the process for clinics that are already connected today. I guess I should click through the slides too. All right, in an effort to prevent any stumbling over a mouthful of titles, I'm going to use the term physicians as an umbrella term that's going to include physicians, nurse practitioners, and any other allied health professionals that will be using the SPIRE HRM interface. Okay, so you heard about SPIRE HRM and you're excited about it and you want to get connected, so what do you need to do? The first thing is the clinic needs to contact the SPIRE team via email to request a subscription to the SPIRE HRM interface. The clinic will also make sure that they notify their EMR vendor that they are subscribing to the SPIRE HRM project. It's important to know that the SPIRE HRM team ourselves, we do not charge anything to be connected to the interface, but your EMR vendor might and likely will. So make sure you do talk to your vendor to see if there are any associated fees. At this point, our senior change management lead will verify the clinic information you've provided and assign your clinic to a change management site support rep like myself. At this point, the assigned change management site support rep will set up a time to meet with the physicians to review the implementation process and complete the legal agreement and OneID application if necessary. For anyone that isn't familiar, a OneID is a unique identifier created by eHealth Ontario to provide healthcare providers with access to secure health record information. At least one healthcare provider in the clinic must have a OneID with eHealth in order to subscribe to SPIRE HRM. If you are not sure if you have a OneID, you likely do not, but not to worry, any one of our site support specialists would be happy to help you through that process. At this point, the site support rep will leave with the clinic a SPIRE HRM implementation package. It is important that everybody that will be using the SPIRE HRM interface goes through this implementation package to make sure that they are aware of what's about to happen and what's expected of them throughout the process. So after that, the site support rep will leave with your completed legal agreements and OneID application, and will process these documents with eHealth and Ontario MD on your behalf. It's important to note that this process will take between 4 and 6 weeks. So this is actually why we have those enrollment forms and readiness assessments already included in your packages you have today, so we can get that ball rolling ahead of time. The site support rep will contact that clinic to set up a date to have the SPIRE HRM connection turned on, and also to come on site to validate the reports that are coming through, and also to offer some support and training to the team. During this coordination call, a workflow process assessment will be completed as well. This is done to anticipate what changes the clinic should prepare for with the transition to SPIRE HRM. Okay, so it's go live day. So your SPIRE HRM connection is turned on. Now what happens? The site support specialist that you've been working with is going to come back on site. They'll complete a confidentiality agreement to make sure that we protect the privacy of the patients and of the clinic. And then we will review with you the types of reports the clinic should expect to receive via SPIRE HRM. We will also use this time to demonstrate how SPIRE HRM interacts with your EMR, and we will be available to offer training and support to anyone on the team that will be using the interface. When we are completed the validation of the interface and the training and support, the site support rep will leave a clinic the copy of the sign-off document. This is the document that the clinic will complete once they are happy with the interface and they are ready to have their faxing turned off. We'll also leave with you that fax deactivation request and a user guide. All right, so you've had the SPIRE HRM interface for a week or so and you're happy with it, but now you're getting fax copies and electronic copies, which just means extra work. So how do we get that to stop? With you, you'll have your sign-off and fax deactivation request that I left, or one of our site support reps left with you during the on-site visit. And you'll complete that document and send that to your site support rep. They will work on your behalf with the hospital to ensure your faxing is stopped. About a week or so after the faxing has been stopped, your site support rep will follow up with you once again. This is a great time to ask any additional questions, voice any concerns or comments, and basically just to give a brief summary of how you felt the implementation went and what you're looking for future support. Okay, so there's a number of you that are already connected to SPIRE today. And the SPIRE connection today, as a recap, is a connection to just the London hub. If anyone in this room is not currently connected but is interested in that current connection to SPIRE, please feel free to see myself or Nika or Fatty or Michelle who are at the back that registered you and signed you in today, and we'd be happy to get that started for you as well. So for the clinics that are already connected today, sorry, I went a little quick. The transition is going to be virtually seamless, as Jason mentioned. What it's going to mean is that one day you're going to be receiving reports from a much broader geographic area. There's going to be some new agreements to sign, but the interruption to the service is rather minimal. Okay, so now the site support rep will schedule another on-site visit, and this is just to complete that legal agreement and that one ID if required. After that, once we have all those documents processed, we'll get in contact with you once again through our coordination call. And this is the call where we will schedule a go-live date, where the site support rep will come on site to validate those new reports coming through, and also again to offer some continuing support to your team. On the go-live day, this will go very similar to your previous go-live day, where your site support rep will begin with that confidentiality agreement. They'll again review the types of reports you'll be receiving and the filtering rules. We'll also complete the SPIRE HRM validation and testing document, and we'll provide an updated SPIRE HRM user guide for your clinic. Please make sure that you do use this new user guide, as the support model will be changing with the SPIRE HRM transition. Okay, so after your migration to HRM, we'll give you a quick follow-up courtesy call. Again, this call is used to ask any questions, voice any concerns, basically any loose ends that need to be tied up. Now, it is important to note that just when we're done this follow-up call doesn't mean that our support stops there. We are always available to help you, to answer any questions, and to facilitate any troubleshooting on your behalf. You can feel free to contact the site support rep that you worked with at any time. We also do have a team email that anybody can contact that we all have access to. That sums up the implementation process. If you have any questions that haven't been addressed, please hold them till the end of the presentation. And again, you can always feel free to contact us via email. All right, at this time, I'm going to ask that Jason joins me again. Or actually, Glenn, if you could join me.
So now we're going to get to our testimonials. So I'm going to invite Dr. Chesky to come up and review with the group from a peer-to-peer perspective what he's finding personally from using the interface, experiences from the team, the SPIRE team, and generally, I guess, open yourself up to any questions the group would like to ask. Thank you.
Good evening, everyone. Pleasure to be here. I've never met Jason before, but you'll see after my talk that they asked me to send my slides in about 2 or 3 weeks ago, and he plagiarized a lot of material off that. So it'll seem like it's duplicated, but I came up with it first. This is what I do. I've been practicing for 25 years in Thorndale, small rural community outside of London, and I work with the university as well, and we do a little bit of fishing and flying on the side. And we have a very busy practice. And we've been on our EMR for 3 years now. Anybody who's moved to an EMR knows that we're finally catching up to the kids. They get to do all this stuff at home, and now we can use all this technology in our offices too. It's just a life-changing experience, and the SPIRE thing has been part of that as well. We serve between the 2 physicians in my office, about 4,500 patients. And we have a computer in each of 6 examining rooms, which are 2 procedure rooms. We have 2 at the front office, 1 at a stand-up counter, 1 in the lab, and 1 in the back lounge. And so just the bathroom. It's the only room that doesn't have a place to work. So everybody's trained on the EMR, and we can sit down anywhere and access that. The good old days when we were getting our stuff sent in, for those who are not on SPIRE and are still doing this, this is what you're doing. You're getting all these reports faxed in, and the staff have to pick all this stuff up, bring it back to the thing. We've heard all the stories about the toner and all that stuff and the streaks that start to come down, and you call the hospital and so on to fix all that stuff. And then they have to attach it all to the patient's file, and then you got to go in and fiddle around and so on and play with it and consume all that time. Where we are now, of course, is that we don't handle all this paper anymore. It's going to be nice to get all our stuff from Stratford now once we hook onto the new system, so we connect all these other places in the area that we have our patients seeing. It's neat to scroll through the things. I came back from holidays in August. I took 1 week off, and there were about 280 messages that came into my box. My staff, thanks Kelly, had to go through them before. That's one thing that's missing, but I know they're working on it. All the complaints and bugs that we have, it's a good thing that we mention all these things, because they're working on a system to try and, when you get a cardiology report, that it comes in already assigned as a cardiology report. So the staff have to go through right now and categorize that and say, or you have to as a physician, and we don't have time for that. So my staff go through the whole list, and they categorize cardiology, neurology, MRI, all that sort of thing. So when I go through it, you can go through 200 and some, 80 some pages in about 20 minutes. And when you go through a file and you look at something that has to be acted on, you go just double click, go into the patient's file, send a message to one of your secretaries and say, listen, on Monday, get this patient in, they need a creatinine recheck, and so on, and you go back to your list and go continue all the way down. So by the time you get to it, and it says, do you want to file them all? And you say, well, yeah, we've acted on everything, it's all done. You hit the file button, and everything is gone. All the messages are acted on, anything that has to be done, it's all been sent. Somebody's going to act on, get people in, or whatever has to be done, or book something, and so on. And so the efficiency with having this stuff just all tucked inside, there's no papers lost or dropped on the floor, or where did this and that go, and so on. It's just remarkable. Moving to the SPIRE, when they got that, was almost as exciting as just getting the EMR in, because we had this massive amount of paper that we're still scanning in, and getting rid of that was just dramatic. So anybody who's getting hooked up and signed up or is on that already understands that. The other thing that wasn't mentioned so far is that for those of us who are doing some research or looking for something, you can do full text searches within the EMR now. So anything that's in there is no longer a PDF. Digoxin is actually a searchable word in all these documents. So if you want to find out who's on digoxin in your practice, or who's whatever, you can just hit hit the word JOCS and do a search and everything just shows up, all your patients. So that's a really neat feature as well to have with all these reports that are sent in. The challenges we talked about, those some of the duplicated copies, and we have those still sometimes, and as soon as I see it, you just whip through it fast, and you can hit the return key faster than you can send that to a paper shredder. The labeling of reports I talked about, that'll be nice when that's all done. And the diagnostic test that comes in, once these filters come in, and we can turn off things, then it really doesn't matter that we're getting bilirubin and the transaminase and the creatinine all in one separate file, each report, because we're not going to be getting those anyways. So those are the things that we'll turn off because they're of no value to us in our offices. The length of the patient record is affected by some of those now because it adds this big long string in, but as I mentioned, that's something that's down the road will be cleared up. The pending reports is a bit of a nuisance too because there are things that you get a full report that an ECG was done and the hard copy's in the hospital or somewhere. And I'm sure that sort of thing is being worked on as well to sort of filter out some of those things. In the end, the office efficiency, Jason mentioned something like a 90% time saving, without a doubt. And so this stuff, you just scan through these. A couple of times in the day, I open up my box, and usually there's 30 or 40 things in, and you just whip through them in 2 or 3 minutes, literally, and boom, they're gone and filed. It's just, as I said, remarkable, the time saving. Everything is received fast now. You say it's going to come faster. I'm pretty happy right now. That just the rate that stuff comes in. So, but we are getting more and more anxious that we want things instant, and for sure it's coming. Once we get hooked up now, that we get Stratford in the same areas and some of the other places coming in with the upgrade, then that's going to make a big difference for us as well in terms of collecting some more of that information locally. We have patients now going to Kitchener for hip surgery and all that sort of thing, so that's going to all come. So that's going to be nice. We're shopping out of town a lot of stuff now, and Guelph and so on. So what it's done is just like bringing the EMR, and it's happy staff and happy physicians, and all of this stuff. 25 years from now, the young physicians, Andy, who will be in practice for 25 years, he'll be saying, I wish I was just a first-year family medicine resident starting, because look at what these guys now have. So everything that we're getting today, I'm thinking Andy's starting without paper and all this sort of thing in Frank, and it's going to be just exciting to walk right into this. And I'm sure 25 years from now, this system will have matured so much that it'll be that much more dramatic, and it's an ongoing flow and process, and it's just great to be part of it. Thanks.